In 2008, I lost my 17-year-old son, Jonathan, to Missouri's criminal justice system. First, I would like to put our story in context. Each year, 200,000 youth are prosecuted as adults, and every day, 10,000 kids under 18 are locked in adult jails and prisons. This practice exists even though research shows that prosecuting youth as adults actually increases crime. Other studies show that youth in adult jails face physical and sexual assault and little to no access to education, mental health programs, or substance abuse treatment. As my family tragically knows too well, youth in adult jails are 36 times more likely to complete suicide in jail than juvenile detention. In July 2007, my son Jonathan, who was 16 years old, made an extremely poor decision. His ex-girlfriend called to say that she was pregnant with his baby but was going to commit suicide because her new boyfriend was going to force her to kill the baby. Under the influence of drugs in what he thought was an attempt to save 2 lives, Jonathan shot the boyfriend, who survived, to scare him into leaving the ex-girlfriend alone. Thinking the police would understand, Jonathan immediately turned himself in. I believed Jonathan should be held accountable, but I never imagined what he would face in the adult system. He was first placed in juvenile facilities, including a psychiatric hospital and a juvenile detention center. While in the hospital, Jonathan was prescribed a high amount of antipsychotic medication that took several weeks for his body to adjust to. In the meantime, he suffered recurring nightmares and hallucinations of blood running down the walls. In the detention center, he was allowed to stay caught up in school. On September 6, 2007, he was transferred to the adult system and placed in an adult jail. A 140-pound, slight-built, 16-year-old child among much older, bigger men. On his arrival, all his medication was abruptly stopped due to the jail's anti-narcotics policy, causing intense withdrawal with shaking, more hallucinations, and severe depression. At the jail, he could no longer continue his education. His school no longer sent homework, and he was dropped from their roster. This was really hard for him because he loved school. He had a lot of friends, good grades, and good relationships with his teachers. He was working towards scholarships and to become a doctor or a psychiatrist. He tried to work on a GED book, but the jail was too noisy and no one would help or support him. At night, he couldn't sleep as the lights were kept on and the adult inmates stayed up. Jonathan timed trips to the restroom or taking a shower to avoid being assaulted. After 2 weeks, he was transferred to another jail in Charleston, Missouri. We were allowed only one 15-minute visit a week through glass by talking on a phone. On our first visit, my husband and I were shocked. Cuts and bruises covered his face and head. His hair was shaved, and he had a new tattoo that other inmates said he needed to survive. The night he arrived, he had been attacked by a fellow inmate coming down off meth from the meth lab in the jail. I immediately broke down and wept because I was utterly powerless to keep him safe. He kept trying to reassure me that he would be okay, but we both knew he wouldn't. In our next visits, Jonathan always had stories about violent things he saw and comments he heard from other inmates on how to survive, and was constantly trying to strengthen his body to survive attacks. Although he was recommended for Missouri's dual jurisdiction program, which allows youth up to 21 tried as adults to serve their time with other youth, the judge denied him this opportunity. After being placed in several other facilities, Jonathan learned he would be going back to Charleston, the same town where he had horrible jail experiences. This possibility was too much for him, and on January 4th, 3 days after his 17th birthday, he was found hanging in his cell. While in jail, Jonathan lost everything: freedom, friends, safety, privacy, sanity, childhood, scholarships, college, dreams, Six Flags, family vacations and holidays, and time with his brother, sister, and a close extended family. Jonathan's experience taught me that no child should be placed with adults no matter what, because when children are put with adults, they die, physically or mentally. I also believe that all kids deserve a second chance. As a parent, one of the most frustrating things for me was that the court, the judges, the prosecutors didn't know my son. They hadn't raised him like I had, but they weren't willing to give him the second chance they might have given their own kids. Finally, if the criminal justice system is supposed to keep our communities safe, how safe can they be if a kid has spent 5, 10, 15 or more years in the conditions Jonathan faced and with the role models he had? In closing, I urge the committee to extend the jail removal and sight and sound core protections in the JJDPA to youth in the adult system. I also ask that you allow states the option to let youth convicted in adult court serve their sentence in juvenile facilities rather than adult prison. Thank you again for having me here to testify and for giving me the chance to share my story, my family's story, and Jonathan's story with you.